Hey everyone, happy to have you here again. We're going to take a real good look today at two of the most popular Medicare supplement plans, Plan G and Plan N. As a bonus, I'm even going to throw in some really interesting information on the High Deductible Plan G at the end, so be sure to watch all the way through. Like most retirees, you're likely hearing that both Plan N and Plan G are the two most popular Medigap plans being purchased right now. Are you feeling stuck trying to choose between them? Well, no worries, because it is a very common feeling. When we wrap up this video, you'll get an idea of which plan fits you like a glove. Okay, so let's dive into it. Let's brush up on what Medicare supplement plans are. They're also known as Medigap plans. These private insurance policies aim to fill in the blanks left by original Medicare, areas like deductibles, coinsurance, and copayments. A big perk of Medigap plans is how adaptable they are. You've got the freedom to pick any doctor or medical facility in the United States that takes Medicare. In addition, if you need to see a specialist, you won't be needing any referrals. Okay, so first up, let's talk about the things that Plan G and Plan N have in common. Both cover your Medicare Part A deductible, which is $1,676 in 2025. Both provide additional coverage for extended hospital stays that last past 60 days. They even give you an extra 365 days in the hospital after what original Medicare allows. With both plans, you will be responsible for the Medicare Part B annual deductible. Currently for 2025, the Part B deductible is $257, which must be satisfied before either plan will start paying any Part B benefits. Now, wherever you are in the U.S., as long as a provider takes Medicare, these plans have you covered. You really need to weigh these differences when picking one plan over the other. Number one, copays. After you pay your Part B deductible, Plan G will start paying the remaining 20% of approved Medicare charges. Unlike Plan G, the Plan N requires a bit of cost sharing. For many doctor's office visits, you will have to pay up to a $20 copay, and if an emergency room visit happens, but they don't keep you overnight, you might have to pay up to $50. Now, number two, Part B excess charges. With Plan G, you don't have to worry about Part B excess charges because it takes care of them all. Plan N does not provide coverage for excess charges. Now, before you start to get concerned about excess charges, it's important to understand that these amounts are capped at 15%. This means that if you go see a provider that charges excess charges, they can only charge an amount that is no more than 15% above the Medicare approved amount. An easy example of this would be going to see a doctor and they send a billed amount of $120 for that visit to Medicare. Then Medicare basically says, hey, in your area, the approved amount for this office visit is only $100. This particular doctor could then charge you no more than an extra $15. Now, with all this being said, approximately 98% of the providers do not charge excess charges, so most folks will never experience paying any excess charges. Just like in the movie Jerry Maguire, people say, show me the money, since everyone wants to know how much these plans cost. Typically, you will spend less every month for Plan N than for Plan G. Think about $20 to $50 less. Now, let's expand on this with a real-life example. Okay, so for the particular example, we're going to use a 65-year-old female in the state of Maryland who does not use any tobacco. For a Plan G, she would pay right around $137 per month. And on the Plan N, that would run her around $108 per month. On the surface, the Plan N would save her $29 per month or right around $348 for the year. But wait, there's a catch with Plan N. We have to include those copays that you have to pay. When we take into account that there is around a $350 annual savings between the two plans, the savings would cover right around 17 doctor office visits where she would have to pay a $20 copay each time. The idea of going to the doctor more than 4 times in 1 year sounds like an unlikely feat, but it really isn't. If you have a chronic condition that requires a specialist in addition to your family doctor, you could be seeing both of those doctors easily each quarter, which would be about 8 visits right there. If you have multiple chronic conditions, then your list of doctors will continue to grow. You really need to dig into your health past and how much you need to see your doctors each year before you pick between these two plans. So, is there always a $348 annual difference between the plans? Definitely not. There are different factors that come into play, such as your age and in what state you reside in. In some states, insurance companies will use area factoring, which is a fancy way of saying that if you live in a particular zip code, you could pay more or less than the same person residing in the same state but in a different zip code. Let's look at another example. This time we're going to use a 68-year-old male who is a non-tobacco user. He lives in the town of Greencastle in Pennsylvania. For a Plan G, he would pay around $134 per month, and the Plan N would cost him around $94 a month. Here, the savings would be about $40 per month or $480 for the year. My last example is for a 70-year-old female non-tobacco user who lives over in Martinsburg, West Virginia. A Plan G would cost her around $115 per month, whereas the Plan N would only cost her $90 per month. This is a $25 per month or $300 per year in savings. Now, so with these rates being different depending on your age and location, another factor you need to take into account when making a choice between Plan G or Plan N is future rate increases. Unlike a number of agents out there, this is a topic we don't shy away from, because the reality is that you are getting health insurance, and the cost of healthcare continues to rise along with how much we use it as we age. Over the last few years, we have definitely seen where the Plan G has taken on higher rate increases than Plan N in many states. Without going into too much insurance jargon, the main thing that drives these rate increases is referred to as an annual loss ratio. This is a technical way of saying the insurance company at the end of the year looks at how much they collected in premiums compared to how much they paid out in claims. If they ended up with low loss ratios for that year, then you might not even see a rate increase at all. But if they paid out more in claims than expected, you would see a rate increase. One thing to know is that you cannot be singled out for a rate increase due to you using your insurance more in one year than in another year. Rate increases are based on statewide totals. Okay, let's chat for a second about what they call guaranteed issue rights. If you qualify for a guaranteed issue enrollment and sign up for Plan G, it lets you bypass having to answer any health questions. Plan N doesn't qualify for guaranteed issue, which does help keep claims lower since you would need to answer the health questions and qualify. Of course, this does not apply when you're first going on to Medicare Part B, which lets you qualify for any Medicare supplement plan since you are in what's called your open enrollment period. So how do you choose which plan to get? Well, if the most important things to you are knowing all of your costs up front to avoid any surprise expenses, then Plan G might be the way for you to go. With Plan G, you know how much your monthly premium will be and that you will be responsible for the annual Part B deductible. That's it. On the flip side, if you don't mind small copays now and then and are not worried about excess charges, then Plan N might just be the better way for you to go. If you're torn between picking between Plan G and Plan N, first thing to do is take a good look at your health needs. If you see doctors often or need to go see a specialist a lot, Plan G might be the better way to go. Think about money matters. If you're okay with paying less up front and paying co-pays when you see your doctors or go to the emergency room, then Plan N could be the better option for you. Now, as promised, I'm going to go over the High Deductible Plan G. Believe it or not, almost no Medicare supplement agents or Medicare Advantage agents out there discuss this plan. As we previously discussed, the traditional Medigap Plan G is one of the most popular plans currently being purchased. The High Deductible Plan G is basically the exact same plan except for one main point. Instead of just having to pay the Part B deductible each year as you would on a traditional Plan G, the High Deductible Plan G has its own deductible. For 2025, the deductible for the High Deductible Plan G is $2,870. Now, it's important to keep in mind that this deductible can change from year to year since it's tied to the Consumer Price Index for urban consumers. Let's take a quick look at how the deductible has changed over the last 6 years to give you a better idea how it can fluctuate. As you can see in 2020, the deductible for this plan was $2,340 after it had taken a very small 1.2% increase due to a low inflation rate. In 2021, we saw a 4.7% increase due to economic factors such as supply chain disruptions and stimulus spending. In other words, we were entering into an inflationary period. In 2022, the Consumer Price Index for urban consumers surged 8%, which drove the deductible up to $2,700 for 2023. Currently, we're seeing a cooling off of inflation pressures, and the Consumer Price Index for urban consumers is hovering right around 2.8%. As inflation continues to decrease, so will the increased percentages that directly affect the deductible. Now that you have a better understanding of how the deductible can change, let's explore how the plan works. On the surface, it can sound confusing, but it really is quite simple. First off, your Medicare benefits work exactly the same way they always have. So for a moment, we're going to look at this as if you did not have any Medigap coverage at all and just had traditional Part A and Part B of Medicare. If you are admitted into the hospital, then you have your Part A deductible, which must be paid. That amount for 2025 is $1,676, which covers you for the first 60 days you are classified as an inpatient in the hospital. Additionally, while you're in the hospital and are being seen by providers such as doctors and surgeons, you're responsible for the first $257, which is the Part B deductible for 2025. And then you're going to pay 20% of the Medicare approved charges. Once again, we are only talking about Medicare right now. As you may remember from one of our earlier blog posts, hospitals bill under Part A of Medicare and providers bill under Part B of Medicare. It is important to remember that even if a doctor sees you in the hospital, they must still bill under Part B of Medicare. Of course, if you had a traditional Plan G, the Part A deductible would be covered, and then after you paid the Part B annual deductible, the remaining 20% of Medicare approved charges would be covered by the Plan G. If you went down the path of having a high deductible Plan G, then under Part A of Medicare, your Part A deductible, like we said, of $1,676 would be applied towards your high deductible Plan G deductible of $2,870. This means that you would now have $1,194 left to satisfy on your plan deductible for the year. Since you're likely going to be seen by multiple doctors and possibly even a surgeon while an inpatient, you'll be responsible for your Part B annual deductible. As we said in 2025, that amount is $257. This will be applied to your high deductible Plan G and reduce the remaining deductible down to $937. From this point, Medicare would step in and start paying 80% of the remaining approved charges, and you would be responsible for the other 20%. That 20% you're paying would be applied towards the remaining $937 left on your plan's annual deductible. Once your 20% in out-of-pocket payments has hit that $937, your high deductible Plan G begins to pick up all remaining costs with nothing more out of your pocket. So in your mind right now, you might be saying, why on earth would I sign up for a plan that has a $2,870 deductible? Well, let me tell you, when the high deductible plans first came out, I thought the same thing to myself. But here's the reason why you might want to consider it. If you're relatively healthy and only see a doctor a few times a year, the savings could be massive. Let's look at the premium for a high deductible Plan G versus a traditional Medigap Plan G in the state of Maryland for a 65-year-old female who doesn't use any tobacco products. As discussed earlier in the video, the traditional Plan G for this individual would be right around $137 per month. The high deductible Medicare Supplement Plan G for the same individual would only be around $44 per month. That is an annual difference in premium of $1,116, which by itself covers almost 40% of the deductible if your health had a dramatic change. This means you would only have to come up with $1,754 out of pocket to satisfy the remaining part of your deductible. The popular argument that I hear against the High Deductible Plan G is that the same individual could sign up for a Medicare Advantage plan and have a zero premium to pay. On the surface, this sounds like a no-brainer, but the story changes once you find out some of the key plot details. Most Medicare Advantage plans in the state of Maryland have a daily hospital copay of $300+ a day for the first 4 to 5 days. So if you were to go into the hospital, you would have to come up with basically $1,500 out of your pocket. Of course, you have other copays and coinsurance amounts that you would have to pay out of pocket depending on what kind of treatment you receive throughout the year. While this might not sound too bad, here's the major plot twist that most folks forget about. It's called the annual maximum out of pocket. This is the amount the Medicare Advantage plan says is the most you would have to pay in copays and coinsurance for the calendar year. In 2025, that amount in Maryland is right around $7,500. So with a high deductible Medicare Supplement Plan G, the maximum out of pocket you would have to pay in 2025 is $2,870 versus $7,500. This is why you need the whole story before signing up for your health insurance plan. Oh, I almost forgot to mention, the High Deductible Plan G doesn't use a network. You can see any provider that accepts Medicare, whereas a Medicare Advantage plan typically will require you to use their network of providers. Now, since you stayed all the way to the end of the video, I'm going to give you an additional bonus. With a High Deductible Plan G or even a Medicare Advantage plan, your biggest initial exposure typically is if you have to be admitted into the hospital. If you were to stay 5 days in the hospital, you would be responsible for the $1,676 Part A deductible if you had a High Deductible Plan G, or if the Medicare Advantage plan with a $300 per day copay would make you responsible though for $1,500. So either way you go, you're still paying out of pocket at least $1,500. Did you know that the same 65-year-old female could eliminate that hospital cost for right around $20 per month with a hospital indemnity plan? Yep, for about 67 cents per day, you could have a hospital indemnity plan cover those costs for you. Think back to the old NBC public service announcement in the late 80s that said, the more you know, the more you know. Keep in mind that the last thing you want to do is go at this alone. That is why you can always feel comfortable and confident knowing that a senior benefit services advisor will not only have your best interest top of mind, will also make Medicare easy. Check out the links below on how you can reach us. Like what you saw today, pass this video on to other folks you know on Medicare who could use these same tips. And hey, hit that subscribe channel to stay in the loop with all things Medicare.